In Fox 5 Health News, annual mammograms may be able to detect more than breast cancer with the help of additional technology. The screenings can also give some information about a patient's risk of heart disease.
All right, joining us now, Fox 5 medical contributor Dr. Devi Nampiaparampil from the NYU School of Medicine. This is a very interesting story about the use of AI, because basically you're looking for breast cancer, but you're also gathering other information, and now we can sort of use to put a bigger picture together of your overall health.
Yeah, I think it's very exciting, all these applications and how AI can gather all this data and analyze it. I mean, how you use the data, that's the human factor, right? So there's still some pros and cons. So basically with mammograms or anything that looks like x-ray, you know, black is sort of the soft tissue and white is anything that has calcium, so bone, for example. But sometimes calcium can also be a sign of injury. So sometimes, very rarely, some of these calcifications can be cancer, but they can also outline an injured artery. So arteries are carrying blood, right? And if you have a heart attack, what's happening is that artery is clotting off because of the injury. So what this test is doing, you know, when the AI uses it, is basically looking if there are signs of any kind of injury to arteries in the breast. And if there is in the breast artery, that might be a sign that the same type of injury is happening in the arteries that go to the heart, right? So the way you use the data depends, because if you see that and you think, oh, maybe that could be a sign of increased risk, maybe you change things and try to lower your risk. But on the other hand, if it comes back normal and you actually are high risk for heart disease, you might get misled. So it's a little bit tricky, right? Like
they're going to fine-tune that, but nevertheless, it does seem promising.
Oh, yes, it's
and all the more reason to get a mammogram, too.
Of course, another opportunity to talk about breast cancer and about heart disease.
All right, let's get to something more shallow. We like this one. The FDA just approved Botox for use in the jawline to tighten your neck muscle. So these are what these things here go like this, right?
I guess I didn't. Don't do that. Then you're going to have to get this Botox.
Right, I'm going to get that procedure. Yeah.
But I didn't even know that that was somewhere you could get Botox.
Well,
is that okay to do?
Yeah. So some people have done it all along, but now they have the FDA approval, right? So Botox, what it's doing is it's weakening muscles, and then the muscles were pulling on sort of the skin to form these wrinkles or neck bands and stuff. You can actually get Botox in other parts of the neck for migraine and for other types of medical conditions. But in this case, with the FDA approval, what really changes is that you have some standardization, right? So before that, you might have had to pay out of pocket if you wanted a cosmetic procedure. Still, you might have to. But now the company can do some training with the people who are interested. They're allowed to let people know, whereas before they weren't really, you know, you had to do things off-label. You can't really market it the same way. And
every doctor, 15 doctors might have done it 15 different ways, which is the way I saw put in an article.
Exactly, So, you know, for people who are interested in aesthetics, especially for the neck, people can be very sensitive to that. There's more options now.
So maybe you don't have to chew gum to get that strong jawline. I don't know. All right, doctor, thank you so much.
Great.
Appreciate you.
Thank you.
All right, well, Ricky Ricardo has been calling